Registration is good. Okay. Let me share. Let me share the PowerPoint. Right. We start now we start to see. And I say always welcome to the virtual classroom of the M.P.R. International School. Now we have I told you what we are. We are an international school. We teach in the whole world. We teach in America, from the north to the south. We teach in Europe and in Asia, and in different parts of Europe. And then I told you in news, also for you, Spine Action, we got an agreement with the University of the Havana, and the University of the Havana in Cuba will give all the installations to do practical course in Cuba. That means if people want to do travel and learn, you will have the opportunity to came with us in a very, very nice country like East Cuba. We can enjoy practice and enjoy country, holidays. Some courses we do there, some courses in the maybe the long-term courses, because I will tell you what are our formation in our school. Say, welcome to our school, and I will start the presentation. This is a new course. That's no new because M.P.R. is no new. M.P.R. I tell all of you, we have more than 42 years teaching M.P.R. M.P.R. is not new. It's a new concept. And M.P.R. is teaching in a lot of countries and a lot of people approve it. I formatted in this 42 years more than 2,500 people, a lot of people who approve this philosophy, because M.P.R. is a philosophy. That is my little CV. I did the resume of the CV, just a little, just to know who I am. And M.P.R., the name is myofunctional postural rehabilitation. That is M.P.R. And you will see during the presentation why I call it like this. And I told you a little history of M.P.R. Why I invent this protocol. I invented this protocol many, many years ago because I understood. I have, for the people who do not understand me, I 47 years working in the medical science, plus 6 years of university. It's 53 years. I have 72 years old, but I feel like a young professional. And when I discovered many years ago that in medical sciences, we don't have a common language. We see in a patient in our point of view. That means the point of view of our specialization. And that's not good, because maybe we can be good professionals, but if we work alone with no communication with the others, we cannot do a good treatment. And you will see during the presentation what I mean that. What I mean that, okay? All right. Let me put shorter there, okay, on the back. All right, and then why I said it is a revolutionary method, because it is a revolutionary method. It's the only one around the world that teach the people to talk the same language and to work with the same diagnosis. And that, in my opinion, is very important. It's a form of prevention. That is prevention, because when you go to the beginning and you go to the root of the problem, you prevent the treatment. You don't do only symptomatic treatment. And that's why we said that. And it's a very simple and effective protocol. M.P.R is not a technique. We have a lot of techniques inside the M.P.R, and we teach it. We teach a lot of techniques, but M.P.R is a method. A method is a way to arrive to the treatment good. It's a diagnosis and treatment method in, obviously, neuromuscular skeletal dysfunction for all medical sciences, because most of you are physiotherapists, but all medical sciences deal with neuromuscular skeletal dysfunction. And what is the objective? The objective is to put in balance something special, who is craniofacial system, with the rest of the body. We know craniofacial system about t.m.js. t.m.js is nothing. It's just a part of this system. But everybody thinks I am a specialist in t.m.js. It's the same when I am saying I am a specialist in that finger. That's not good. t.m.js is here and is part of the craniofacial system. And when this craniofacial system is dysfunctional, it will affect the rest of the body through the muscle chains. And you work with muscle chains every 5 minutes. And that's why we said this particular method puts together in balance craniofacial system and the rest of the body, and you will see. And as I told you before, a way to study, theory online, practice in place. With M.P.R, we unify diagnosis. That is the true interdiscipline, you know? That is the very, very true interdiscipline. We study clinical diagnosis, posturology, obviously, and complementary analysis, because it's very important. The internal of our body is working well. You cannot do a good rehabilitation, any technique you apply, any. We are not talking about that technique is better than the other, that the other is worse. No, they are techniques. But if you don't have a good environment in your body, if you don't have intoxication, if your body is clean, in the moment, you can have a good rehabilitation. Objective of the M.P.R is an holistic diagnosis. What they mean? They mean diagnosis of the whole body, not sectional diagnosis. We have to speak the same languages. I speak 4 languages. Now I'm speaking in English with you because it's the only way we can communicate. If I start to speak in Italian, Spanish, or French, maybe you don't understand. That's happening in medical sciences. We have to speak the same language. Treat with the same optician, the same optic, the same protocol of action, go into the cause of the problem, cancel the attack, the aggression of the body, to get a good rehabilitation with no recurrences. That is the goal of M.P.R. Some rehabilitation techniques relapse because we do not treat the whole body. We don't have a good balance. what I mean, it is not the technique who cured the patient. Technique is a tool, you will see. Technique is a tool, and it's an important tool. Yes, it is an important tool. Without tools, we cannot work. But if I don't know how, where I have to go, it is impossible to treat the patient. What we understand, not just that we have to refer the patient. This is not interdiscipline. This is derivation of the patient. It's not the same thing. See it and treat it with the same optics. That's very important. Diagnosis and treatment following the same way, the same protocol of action. That's very, very, very important. Very, very important. This is the true interdiscipline. Believe me, that is the true interdiscipline. M.P.R, it's an integrated interdisciplinary protocol for all health sciences, so that they can communicate with each other and treat the patient with the same optic. It is a diagnostic and therapeutic method which acts in a physiological and natural way. And this is important. It's not aggressive. What is M.P.R? A diagnostic and therapeutic method that use tools of the different disciplines. Obviously, we use manipulation. We can say we choose this kind of manipulation, but we use manipulations. And the protocol, interdisciplinary protocol, is active protocol because it's adapting at the evolution of the patient. Any time you can adapt the protocol at your patient. It is integrated because a specialist intervene with the same diagnostic and therapeutic approach. And it's interdisciplinary because, obviously, various disciplines working together. And M.P.R, that means myofunctional and postural rehabilitation. It is myofunctional because physiologically treats the neuromuscular skeletal balance. It is postural because do rehabilitation of stomatognatic system or craniofacial system with the rest of the body. And it's rehabilitation because balance the whole systems. A good rehabilitation have to balance the whole systems. And that's the goal. In the M.P.R, we deprogram and reprogram. Deprogram is taking out the aggression, and reprogram is making the body working as before. Holistic balance, the whole body in balance, not just one part of the body. We study also posturometry. We measure, you will learn that in our course. The posturometer is a good instrument, it's an objective instrument that allows us to do an objective diagnosis, and not also that, just to follow the evolution of our patients. Good instrument. That is the instrumental diagnosis. Posturometry and stabilometry. This instrument is based with the concept of Kepanji, of the body weight distribution. You will learn that in that course. the posturometer. We study the food hypersensitivity, that is alimentation, and the amino acid deficit, because if all these things are in balance, muscles are in balance, rehabilitation will be good. And the tools, and that's the tools. The tools, we have a lot of tools, but in that course, you will learn, obviously, the deprogrammation tools. That is common for the whole medical sciences. What they means? We have to deprogram the systems. If we do not deprogram the body, we cannot allow a good rehabilitation. We have aggression. We have a lot of aggression. Imagine we have a headquarter into the body. Nobody wants to build the houses during the headquarter. In medicine, we do that. We have to stop the aggression. When you stop the aggression, your rehabilitation in any field, in any medical science fields, will be perfect without recidivism, because you take it out. The main thing, that is the aggression of the body. We cannot do any rehabilitation, any manipulation, any dental treatment, any medical treatment if we don't put in balance the body first. And we cannot put the balance the body first if we don't take out momentarily the aggression. That is the deprogramming tool. That is the goal I invented many years ago. Deprogramming. That is the tools you will learn in this particular case. And how with the programming? With the programming, obviously, sensorial deprogramming, we call that. We call that this is the instruments for deprogramming and reprogramming therapeutic priorities. With the diagnosis, we will learn what is the priority, and we start to deprogramming for this priority. Normally, we study in posturology the oculomotor system, the craniofacial system, the podal supports, and the biochemistry. With the diagnosis, we will see from where we can start the programming. For the oculomotor system, we use some magnetic fields for the programming and exercises for reprogramming. You will learn that in that course. The bed is, I invented that device more than 50 years ago, and it's a device for all medical sciences, not just for dentists. It's to annulate that. That's why I call not bite, not dental bite. It's a body equilibrium device, because annulate the aggression of the craniofacial system to the muscle chains. And when you annulate the aggression to the muscle chains, obviously, you can do a good rehabilitation. This is for dentists, for reprogramming. The reprogrammation, if we need, dentists have to do that. Foot supports, this is the different insoles to use in for the deprogramming and the reprogramming. I will teach you the different kinds of these insoles that are for deprogramming, and in the practice, we will learn how to create the reprogramming insole. We call that physiodynamic insole. How to we can do the diagnosis and the projection of the insoles, and anybody after that can build it. That will be in the practice. Biochemistry, obviously, detoxification, diet, that's very important. And I will show you some patients, and then after finish the webinar, and then we can talk together. All right, we can do any questions. Some patients that you can treat with the M.P.R. Imagine the scoliosis. Scoliosis, most of the we call that most of the scoliosis are adaptative. They are 5% of the scoliosis are real scoliosis, and all the adaptative scoliosis have to deal with craniofacial system dysfunction, biochemistry, foot support. Patients, you can individuate a real short leg, a false short leg. The craniofacial system is involved, and postural alteration. In a child, we always said that in a child is very important to make a prevention. That's why we teach to work together physiotherapists, osteopaths, and dentists with the craniofacial orthopedics for the dentist, with the help of physiotherapists and osteopath. Imagine, interdiscipline. In that age, we can prevent the future. We can prevent that situation. Look at that. This is not the same patient like this, but yes, the same pattern of dysfunction. At that age, we can prevent a patient arrive like this. That's very important, prevention. Prevention is the main goal in medical sciences. This is the posturometer. You see how you measure, all right? Look at here, the mouse. Before the treatment, the overload, and after, 0 kilos. These situations, and obviously sometimes the dentists don't know how to deal with the rest of the body, don't know how to do diagnosis in the rest of the body. And the physiotherapists and the osteopaths, they don't know how to do a good, real diagnosis of the craniofacial system. In M.P.R, both together, dentists, medical sciences, medical doctors, physiotherapists and osteopaths, they will learn how to do a good diagnosis for the craniofacial system and the rest of the body. Look at here. 4 kilos after deprogramming, 0 after bed. Another kind of patient. Also, the mouse is involved with here. And look at here, 4 kilos, 0 kilos. Patient with a lot of problem. Look at the neck, look at the face. Look at the posture of this patient. Those are patients to be treated with the M.P.R protocol. And also the mouth, the craniofacial system involved. Same here. Oculomotor system, craniofacial system. You will see how they are connected. You will see that in M.P.R, how they are connected. Craniofacial system and oculomotor system. How we treat it? Start the physiotherapist, start the optician, start the dentist. Who can start? They have to work together with the same protocol. Look at here. The same. the same patient. Craniofacial system dysfunction, oculomotor system dysfunction, postural alteration. We have to work with a neurological integration. And also a real short leg. Look at that patient, young patient. And you see this posture, and you can imagine it's a postural problem. But if you go deeply, you understood that this is a real scoliosis, where the spine is bigger than the body can allow. This is a real scoliosis, not functional, real scoliosis. And you see the mouth, the oculomotor system, and the postural alteration. All of them need a combined and interdisciplinary treatment. Look at this guy. Was operated a lot of times. A lot of times. Pain here, they operate on the back here. And slowly, they do operation, and he always works. Nobody do the integration of diagnosis. Surgeon look only operation. Functional scoliosis. You see here, this is a functional scoliosis, and it's involved also craniofacial system. Look at here, the posture. Always we have craniofacial system, foot support, and another things. We have to understand how to do diagnosis. And these elderly patients arrive at the end. And now we can do fare better, but that can be prevented many years before. And look at here, patients with treating with, that is a dental treatment, all right, for dentists. But look at that. This patient, they want to operate. They want to operate because they say the jaw is shorter. And look at how it's changing. No operation, just myofunctional and postural rehabilitation. From here to here, he do not do any surgical operation. Obviously, we work together, physiotherapist, osteopath, and myself. Also here, craniofacial, during the growth, how we can change. Sometimes you see orthodontics that they take out teeth, like nothing. They will take it out to put the teeth straight. That's very wrong, very wrong. Look at here, prevention, how? They change. They change the face, the teeth, and the posture. This age is to start. That was a patient with a postural alteration due to a retroposition of the jaw and no good growth. We start the therapy very early, and look at the difference. Look at the difference. Look at the difference and look at the posture at the end. It's perfect posture. Starting like this is now. Look at how it's changed, like this from this. This is postural rehabilitation. Not only teeth, not only body, it's all together. From this to this. Look at the torsion. Before and after, how the torsion changed. You can measure that with the posturometer. Yeah? This is the holistic protocol. This is M.P.R, and this is the thing we try to teach to you with the spine action collaboration. And that is the thing. Thank you for your participation. And if you have any question, I am here. I start to sharing. And if it's any question, you can write the question if you like. That sometimes it's better because the voice is not good sometimes and very difficult to understand. But if you can write a question, I'm very grateful to answer that. Okay, I think there is no question, Robin and Krishna. Yes.
Hello.
Yes, hello.
Yes, sir. Sir, I would like to thank you on behalf of Team Spine Action. Thank you so much, sir, for giving your valuable time and explaining the concept of M.P.R. and basically our 6 months fellowship program of M.P.R. on posturology. To all the participants, so sir has already given us a brief idea about M.P.R. So whosoever is interested, kindly reach out to us. You can contact any of the members. We will be sharing our details, our contact numbers, so you can go ahead and proceed with the registration process. And we shall be starting our class from 14th of August 2022. Our first class starts, so please do the registration before that. And if you have any doubts, you can still reach out to us or Silverio sir, and we can clear your doubts as possible as it is possible from our side. So yes, thank you so much, sir, once again for giving your valuable time on M.P.R. and explaining the concept of it.
Okay, thank you so much for all of you. And I hope the concept was clear. And I hope I see a lot of you in the 15th of August in the beginning of the class. Bye-bye, everybody. Take care, everybody.
Thank you very much, sir. Thank you very much.
Thank you, Robin. Thank you, Krishna. Thank you for your help. And I will see you in the beginning of the course of the 15th of August. Bye-bye, everybody.
Thank you so much, sir. Bye-bye. Thank you.
Bye-bye.